I don't have any sensation in my nipples since my breast reduction. Is this normal? Normal. Yeah, yeah, basically, yeah. I wouldn't say normal. I mean, normal means it happens every time. But is this can this happen? Yes, it can happen. Now, the first question I'd ask, I don't know who's asked this question. I don't know if they're my patient or when they've had the surgery, but um, when you have the surgery, it is often a problem early on. So when you first have the surgery, having numb nipples, sometimes increased sensitivity in your nipples, is actually quite normal. I would say it is quite common, but it usually settles. If it's going to settle, it takes 9 to 12 months to settle, and it might not settle. You might have numbness in your nipples long term. That is a risk of having a breast reduction, and it is related to how far you're moving the nipple. So if your nipple's very low and you're moving it a long way, then you are going to have more risk of those not getting enough nerve supply going to those nipples. If your nipple's not being moved so far, for instance, in a lift or a smaller reduction, then the risk is less. So it is something to be aware of and to sort of go in. Hopefully, if you've had a breast reduction, hopefully you are warned of this preoperatively, because it is not unusual, certainly in the early stages post-operatively. And if it is going to come back, it takes many months for it to come back. And sometimes it doesn't come back. So there is a risk that you might have permanent problems. Although I must say, I've never really had anyone who's had a issue with it. I think it feels weird when you first have it. I think later on, it either comes back to life or you learn to live with it. And it does either way.